Does it look good? Looks great.
I look good.
Yeah, it looks good.
Oh, I don't know about you.
Should run another pair of scrubs.
Welcome back to the Face Duo. I'm Prem Tripathi, facial plastic surgeon in the Bay Area.
I'm Brandon Dunn. I'm a facial plastic surgeon as well here in Southern California, specifically Orange County.
Yes, so today we're going to talk about my least favorite thing. No, it's not my least favorite thing.
What could that be?
We're going to talk about non-surgical rhinoplasty. So
yes.
Things that people do in the nose to not have surgery. Okay. And we will first talk about the procedures, and then we'll talk about how we very much so disagree on, I don't know, the details of this procedure. So, okay.
Let's do it.
Dr. Dunn, what is a non-surgical rhinoplasty? And who's a good candidate?
Okay, a non-surgical rhinoplasty for me in my practice is injecting hyaluronic acid, a dissolvable filler, into the nose to help camouflage a bump or help support or lift a tip. It's a relatively quick procedure that you can do, go home, you see an immediate result, and I think the results can be extremely impressive.
Yes.
So who's a good candidate? Not every single person is a good candidate, and I think if you have a bump of the nose that can end up, if you camouflage it, it ends up blending with the forehead, where sometimes I call it a forehead nose. You don't want that. No one wants that. And so no one wants a forehead nose. If you have really thick skin, or you have a wide nose, or you have an overly larger nose, those can be things that can be problematic when you're adding filler. Because again, filler is not necessarily removing anything. It's adding things to basically give the illusion that a bump is no longer there or the tip is lifted. So it can make a larger nose even larger if you add too much filler, or you add filler to a nose in general.
Okay, so what are some other things that people are putting in the nose besides filler? Maybe I could talk about that, right? Instead of hyaluronic acid filler, there are permanent fillers. So these are fillers that last much longer than hyaluronic acid. They take much longer to break down. Some of them don't break down for 5, 6, 8 years. Which is scary. I would never recommend using a permanent filler for the nose. The other thing is threads, and these are small little stitches or sutures that are put in the nose that build a little bit of collagen. These cause a lot of scar tissue. It can actually cause a lot of issues in the tip of the nose. So the area that Dr. Dunn and I disagree on is whether to perform non-surgical rhinoplasties or not. And my sort of doctrine is, in all the areas where we place filler, there's always a potential risk that the filler gets into a blood vessel. If you get filler into a blood vessel, then that area of tissue will not receive a blood supply anymore, and that area of skin can die off. If you get it into a major blood vessel that then travels behind a particular or interacts with a serious blood vessel, you could have blindness or even stroke. These are much more common in areas like the nose or the forehead, where there's a lot of overlapping blood vessels, or areas where blood vessels don't even need to be injected directly. They can just be compressed because they're small spaces. So you put filler in one place, you compress a blood vessel nearby, and now you're in a situation. So the way I see it is, I don't perform non-surgical rhinoplasties, not because I don't think they can be performed safely. I just think that they should be performed by people like Dr. Dunn, who do a lot more of them and do them more consistently, because I'm not really willing to take the risk of a major event like blindness, because I know with a rhinoplasty, a surgical rhinoplasty, I'm really not going to make anybody blind from that. There are risks with them that are unrelated.
Exactly.
But to me, it's not worth it. But that is, a bias also in my training. What are your thoughts?
So I think a non-surgical rhinoplasty is honestly it's like a test driving of a car. So that, I think it's a fantastic procedure, again, for the right individual.
Sure.
I think everything that we do has potential risks, and even a surgical rhinoplasty has a risk. And and one of the caveats to what you said is that, yes, blindness, which is absolutely terrible and a completely tragic thing to have happen. Horrible, but it's exceedingly rare considering how many injections within the nose actually occur on a daily basis. So I will say that although there is a risk, it is extremely rare. And so that's one of the reasons why I believe that it's still worthwhile to offer this technique. And so,
do you talk to your patients about that potential risk?
I do.
Yeah.
Every single patient that I talk to, every single patient that I do perform non-surgical rhinoplasties, I have a very, very frank conversation. I think it's the right thing to do. And I mean, there are techniques that I have introduced into my practice that I believe limit the chance of this happening. And so those are the things where I feel like, I'm doing everything possible to minimize the potential risks and maximize the potential outcomes.
Yeah, I agree with everything except the one thing about the test driving of a car. I think the rhinoplasty, because you have so much more control over defining a tip or removing a hump or narrowing the nose, it is going to give you a very different result than a filler rhinoplasty, unless you have a very small hump that you're just camouflaging and that's the only thing they're concerned about. Because in reality, that's probably not the only thing you're going to do when you do a rhinoplasty. You're going to create a much more defined nose that fits the rest of the face. But I do think it's a nice treatment that can be done relatively safely in a controlled environment, and it can be reversed if you don't.
That's the other thing.
Yeah. If you're interested in non-surgical procedures, surgical procedures, or anything or all the above, we would love to see you in consultation in our offices. Our contact information is below, and we'd love to share more of these videos with you. So like, follow, and subscribe for more content. We'll see you next time on an episode of The Face Duo.